Okay. Bonjour et merci.
Good morning, and thank you for being with us today.
Canadians must continue to practice physical distancing. We all need to stay strong and stay at home. I'd like to say something this morning to our elders, our aunts and uncles, our mothers and fathers, our grandparents. I've been thinking about you a lot. You raised us. You built our amazing country. Now you are staying inside and you are physically separated from your loved ones. I know that this is really hard, and I want you to know that we love you very much. And we are doing everything in our power to keep you safe. When my children find the physical distancing hard, I remind them that they are doing it for themselves, for the whole country, and also for the elders in our family they love very much. Les Canadiens et Canadiennes doivent continuer à pratiquer la distanciation physique, rester forte et rester à la maison. Je veux m'adresser ce matin aux personnes âgées, nos tantes et nos oncles, nos mères et nos pères et nos grands-parents. Vous nous avez élevés, vous avez bâti notre pays. Maintenant, vous êtes à l'intérieur et vous êtes physiquement loin de vos proches. C'est très difficile. Nous voulons que vous sachiez que nous vous aimons. Et nous faisons et nous ferons tout ce qui est en notre pouvoir pour vous protéger. So today we will hear from our Minister of Health, Patty Hajdu. Then we will hear from Canada's Chief Public Health Officer, Dr. Theresa Tam. We will hear via video conference after that from notre ministre de l'Agriculture et l'Agroalimentaire, Marie-Claude Bibeau. Et après ça, du président du Conseil du Trésor, Jean-Yves Duclos. And we also have with us to answer your questions, Dr. Howard Njoo. Patty, please.
Thank you, Deputy Prime Minister, and good morning to everyone. Let me first start by sending our deepest condolences to the families of those who have lost their loved ones to COVID-19. Our hearts are with you during this incredibly difficult time. We continue to work together at all levels of government to defeat this virus, and in this war, I'd like to remind everyone that we're on the same side. I'm confident there is an end to this, and we will come out stronger together. So in that note, please don't forget to download the Canada COVID-19 app. We've had 123,000 downloads over the last 2 days. This is a very useful tool. It will give you constantly updated and accurate information about Canada's fight against COVID-19. It provides accurate, detailed data about what is happening across the country. And it will also provide you the ability to check your symptoms if you feel that you are unwell or unsure. And with that, I'll turn to Dr. Tam. Thank you.
Hello, bonjour, everyone. So I'll start with the update on our cases in Canada. There are now 11,747 cases of COVID-19, including 152 deaths. Again, this represents infections from previous exposures and not what is happening right now. So again, our urge is that even if you're not hearing about cases in your community, it doesn't mean that there is no risk of exposure, and we must all consider that anyone could be infected and keep our 2-meter distance as the safest approach. We continue to test at a high rate in Canada, with tests completed for over 290,000 people in Canada. Around 4% of these people have been confirmed as positives and 95% confirmed as negative. Maintaining our testing around this 3 to 4% positivity will keep us within a good range to try and accurately detect where the disease is circulating. We are, however, continuing to increase our laboratory capacity to make sure that we maintain this kind of level of sensitivity in tracking COVID-19 activity across Canada. This is a frustrating time as we continue with strict public health measures while waiting for signs of improvement. So far, thanks to all the efforts of Canadians, the health system in Canada is coping, and we need to keep it this way. There are areas where the virus has been the most active, like Vancouver, Toronto, and Montreal, but these areas are managing too. Comme vous le savez, le COVID-19 peut rendre gravement malade, mais l'évolution de la maladie peut prendre plusieurs semaines. En conséquence, les cas sévères dans les décès ne sont pas nombreux pendant les premières semaines. Mais, à mesure que l'épidémie progresse, le nombre de décès continue d'augmenter. Voilà ce qui pourrait expliquer pourquoi nous pouvons voir une forte hausse de décès signalés depuis quelques jours. Cette réalité est un triste rappel que nous devons prendre cette maladie au sérieux. Le fait que des pays particulièrement touchés, comme l'Italie, montrent maintenant des signes que l'épidémie a peut-être atteint son point culminant est porteur d'espoir. As you're aware, COVID-19 can cause severe illness, but the disease course can take several weeks to progress. Hence, severe outcomes, including deaths, will not be occurring in high numbers in the early weeks of this epidemic, but as the outbreak progresses, fatalities will begin to accrue. This could explain why we are seeing a sharper rise in deaths reported in recent days. This is a sad reminder to us all that we must take this disease seriously. We can draw hope from the fact that countries particularly hard hit like Italy are now showing signs that the epidemic may have peaked. We're here to learn about the lessons learned and the perspective of all of these countries as we adapt our responses. Our knowledge, our science undergoes evolution over time. This is a pandemic that has not been with us for very long, and public health colleagues, experts across the country are now continuing to learn and adapt our knowledge as these become available in real time. So, of course, we owe it to everyone to not put another Canadian at risk and to do all we can to stop the spread of COVID-19 right now. Thank you.
Okay, thank you, Dr. Tam. Et maintenant, je donne la parole à la ministre de l'Agriculture, Marie-Claude Bibeau. Marie-Claude, s'il vous plaît.
Merci, Chrystia. Alors, comme ministre de l'Agriculture et de l'Agroalimentaire, ma principale préoccupation en ce moment, c'est de m'assurer que tout le monde ait accès à de la nourriture saine, nutritive et diversifiée. À cause de la COVID-19, les banques alimentaires et autres organisations communautaires n'arrivent plus à répondre à la demande. Elles ont perdu plusieurs bénévoles, souvent des aînés. Il faut réorganiser les installations pour minimiser les contacts avec le personnel. Certaines clientèles à risque sont isolées. Il faut maintenant offrir des livraisons à domicile. Et les dons en denrées et en argent se font de plus en plus rares. Les défis sont multiples. C'est pourquoi aujourd'hui, le premier ministre Justin Trudeau a annoncé 100 millions de dollars pour aider les banques alimentaires et les organisations locales qui sont sur la ligne de front. On compte sur 5 grands réseaux de distribution alimentaire pour rejoindre différentes clientèles à travers le pays. Banque alimentaire Canada recevra 50 millions de dollars, tandis que Second Harvest, Centre communautaire d'alimentation du Canada, le Club des petits déjeuners et l'Armée du salut se partageront 20 millions de dollars. Chaque banque alimentaire de chaque région au Canada devrait très rapidement pouvoir se raccrocher directement ou indirectement à l'un de ces 5 grands réseaux. Par exemple, au Québec, le réseau des moissons est membre de Banque alimentaire Canada. Le solde de 30 millions de dollars sera octroyé plus tard, là où on va identifier les manques. Helping Canadians access healthy food is something we all care about. COVID-19 is increasing the number of Canadians who struggle to access food and is having a major impact on the operations of local food organizations. Food banks of all kinds are being forced to adapt, to find younger volunteers, to minimize interpersonal contact, to offer home delivery. The challenges are great. Today, Prime Minister Trudeau announced $100 million in support of organizations who are on the front lines, making sure people get essential food support in their time of need. Food Banks Canada will receive $50 million, while $20 million has been evenly divided between Second Harvest, Community Food Centres Canada, the Breakfast Club of Canada, and the Salvation Army. These organizations will work with local partners to meet urgent and increased food needs, including those in Indigenous and Northern populations. The last $30 million will be allocated later to fill the gaps and respond to further needs. I invite all my MP colleagues across the country to reach out to their local food banks to make sure they are connected to one of the 5 partners. I want to take this opportunity to also announce that through the Food Policy for Canada, through the Local Food Infrastructure Fund, as of today, 362 projects across the nation have received funding for a total of $6.6 million. Dans le cadre du Fonds pour les infrastructures alimentaires locales, qui découle de la politique alimentaire pour le Canada, j'ai aussi le plaisir d'annoncer que 360 projets ont obtenu à ce jour du financement pour un total de 6,6 millions de dollars. Canadians working in all parts of our food supply chain are stepping up during this extraordinary time. And I invite those who can to please consider supporting your local food bank or community organization. Farmers, folks working in food processing plants, truckers, clerks in grocery stores, and obviously volunteers in food banks are all proud members of a critical infrastructure, the food supply chain. If you're healthy and available, consider joining them. J'en profite pour remercier les travailleurs essentiels qui sont fidèles au poste dans les fermes, dans les usines de transformation alimentaire, sur les routes, dans les épiceries, dans les banques alimentaires à travers le pays. D'ailleurs, hier, la liste des services essentiels a été rendue publique et sans surprise, toute la chaîne d'approvisionnement alimentaire en fait partie. Prenez soin de vous, prenez soin de votre monde et si vous êtes en santé et disponible, pensez à offrir vos services dans le réseau alimentaire. Merci.
Merci Marie-Claude. Et maintenant, je donne la parole au président du Conseil du Trésor, Jean-Yves Duclos. S'il vous plaît, Jean-Yves.
Good afternoon, everyone, et bonjour tout le monde. Aujourd'hui, le message du Premier ministre Trudeau est un message d'entraide. Le premier message important, c'est celui que Marie-Claude vient de résumer, de 100 millions de dollars pour les banques alimentaires à travers tout le pays, et en particulier Moisson Québec, Armée du Salut, et d'autres particulièrement actifs au Québec. Le deuxième message, c'est le devancement du versement du crédit de la TPS, la taxe sur les produits et services, devancement au mois d'avril. On se souvient que c'est en moyenne 400 $ que les ménages avec une seule personne vont recevoir de plus et 600 $ pour les ménages avec 2 personnes. Et troisièmement, c'est un message aussi d'entraide par l'implication des Rangers, des Forces armées canadiennes dans les communautés nordiques et isolées du Québec. On sait que les services des Forces armées canadiennes vont être importants pour appuyer ces communautés isolées qui vivent souvent dans la vulnérabilité. En terminant donc, c'est un message d'entraide pour continuer à garder espoir et continuer à prendre soin les uns des autres pour passer à travers cette crise.
OK, merci Jean-Yves et on est prêt à répondre aux questions.
Okay, we'll start with 3 questions on the phone, 1 question, 1 follow-up. Operator?
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Our first question, notre première question is from Mélanie Marquis avec la presse. Please go ahead. À vous la parole.
Merci. Bonjour, ma question est pour Mme Freeland. Si c'était possible, Mme Freeland, juste de nous faire un résumé des échanges que vous avez eus avec les Américains hier concernant le détournement de matériel médical et également nous dire ce que vous pensez de la décision de l'administration Trump de demander à 3M de cesser d'exporter des masques au Canada. Ça pourrait avoir quoi comme conséquence?
OK. Merci pour la question. C'est vraiment une très importante question, un très important enjeu pour le Canada. Et notre gouvernement est très, très engagé en cet enjeu. Ce matin, la ministre Anita Anand a eu une très bonne conversation avec le chef de 3M au Canada. Je veux remercier la compagnie pour ce que la compagnie a dit en public concernant leur position. Avec les États-Unis, notre gouvernement a commencé très fortement à expliquer la position du Canada concernant cet enjeu. C'est un travail d'équipe Canada. J'ai parlé avec l'ambassadeur Hillman juste 20 minutes avant cette conférence de presse. Nous comprenons l'importance de cet enjeu et tous les ministres, le Premier ministre, moi personnellement, toute notre ambassade aux États-Unis, même les premiers ministres des provinces sont engagés en essayer de régler cet enjeu. On a déjà commencé de parler avec nos voisins et partenaires et alliés militaires aux États-Unis concernant à plus long terme notre collaboration dans la lutte contre ce virus. Alors, vraiment un important enjeu. Le gouvernement est complètement engagé et on va continuer de travailler sur ça. Sure. Est-ce que je peux répondre en anglais? Je m'excuse.
Oui.
So thank you for the question. This is indeed a very important issue, and our government is very energetically working on it. Minister Anita Anand, our Minister of Procurement, had a good conversation earlier today with the CEO of 3M Canada. And I would like to draw everyone's attention to the company's very helpful statement issued earlier today. We are, of course, working very energetically directly with our U.S. counterparts. I really want to emphasize to people this is a whole of government effort. All ministers are going to be and are reaching out to their U.S. counterparts. The Prime Minister is very personally involved, as am I. Just 20 minutes ago, I spoke to Ambassador Hillman about the plan that we have put together to really press very hard on this. And we're also getting some of the premiers involved too. So a very important issue. We're going to just pull out all the stops on this one.
Juste pour aller dans le même sens, Mme Freeland, depuis le début de la crise, on sait que les États-Unis ont eu des problèmes à la gérer, à en reconnaître l'ampleur dès le début. Ensuite, il y a eu les menaces de déployer l'armée. Là, on demande de cesser d'exporter du matériel médical. Quel genre de voisins, quel genre de voisins sont les États-Unis en ce moment, d'après vous?
Les États-Unis sont notre seul voisin, vraiment. C'est une relation qui est très importante pour le Canada, comme tous les Canadiens et Canadiens comprennent. C'est une relation qui est très importante au niveau économique. C'est une relation qui est très importante au niveau social. C'est une relation qui est très importante au niveau militaire. Et c'est une relation, comme les Canadiens ont compris cette semaine, qui est très important au niveau de santé. Et pour chaque gouvernement canadien, travailler avec les États-Unis et trouver une façon de représenter, de défendre l'intérêt national du Canada dans les relations avec les États-Unis est une priorité et doivent être une priorité et c'est une grande priorité pour notre gouvernement. Je ne peux pas dire que c'est toujours facile, mais je peux vous assurer que c'est une priorité pour nous et je peux vous dire aussi que chaque ministre commençons avec le Premier ministre a une bonne relation avec son homologue américain. Et peut-être je peux ajouter seulement une chose. Le coronavirus, c'est une pandémie mondiale. Et ce ne doit pas être étonnant que face à une pandémie globale, tous les pays sont dans une situation d'urgence, une situation de crise. Et dans une crise mondiale, c'est normal d'avoir des enjeux entre des pays. Et je peux vous assurer que le Canada va continuer de travailler fort à résoudre ces enjeux, comme on a travaillé fort à résoudre l'idée d'avoir les militaires américains à la frontière canadienne. Okay, and I'll try to be more brief. All Canadians understand that the relationship between Canada and the United States is an essential relationship for our country. This is a relationship that is extremely important for the Canadian economy. It's a relationship that is extremely important when it comes to Canada's security in the world. And I think we are now understanding it's a relationship that is very important when it comes to meeting our healthcare needs. In times of crisis, like this global pandemic, all relationships at every level can face challenges. And this is no exception. Having said that, we have been working extremely effectively with the United States throughout this pandemic. The reciprocal and collaborative way in which we introduced restrictions on travel between our two countries is a very good example of that. So is the way that we have worked to resolve the possibility of U.S. troops at our border, which Canada strongly opposed. We're going to continue to face challenges throughout this crisis in every relationship that Canada has. We're going to work hard to resolve them. And I do want to assure Canadians that this is a huge priority for our government. And the good news is that every minister in our government, starting with the Prime Minister, has a very effective working relationship with his or her U.S. counterpart. We have a great ambassador in the United States, and we're going to be working hard on this. Thank you.
Thank you, Deputy Prime Minister. Operator, next question, please.
Thank you. Merci. Our next question, notre prochaine question, is from Maura Forrest with Politico. Please go ahead. À vous la parole.
Yes, thank you. This is also for Deputy Prime Minister Freeland on the same question. I believe that Minister Anand has said Canada has ordered 60 million N95 masks, and I'm wondering if you can say how many of those were to come from 3M and if those shipments are still expected to be delivered.
Sorry. Minister Anand had a very productive conversation with the Canadian CEO of 3M. We are very glad about the position, the very responsible position that the company has taken in its public statement. And we continue to work with the company and with our U.S. partners. In terms of the precise breakdown of how many of our masks were going to come from 3M versus other places, I just don't have those numbers right in front of me. But let me say that we're working hard on the 3M shipments too.
Follow up?
Yeah, thank you. Okay, but do we have clarity at this point of whether those shipments will come from 3M or not at this point? And if they don't, can Canada still meet its needs from other suppliers?
We are working very hard on getting those shipments from 3M. And we are also working very, very hard with a diversity of suppliers around the world. We understand in this situation of a global pandemic, it's really, really important for us to have a very, very diverse source of international supplies. And Minister Anand, I spoke with Minister Anand this morning about this. She's very conscious of that. And one of the things she has instructed her team to do is to look for a real diversity of suppliers. And I do want to also emphasize perhaps one of the most heartwarming, as Minister Hajdu described it earlier this week, one of the most heartwarming developments in our fight against this global pandemic has been the way in which Canadian industry has been stepping up, and Canadian manufacturers across the country are working 24/7 to make masks, to make gowns, to manufacture ventilators, to produce test kits, to produce reagent. That is wonderful. I am grateful to them, and that is work that has to continue too.
Merci, Madame la Vice-Première ministre. Troisième question au téléphone, s'il vous plaît.
Thank you. Merci. Notre prochaine question, our next question, is from Émilie Bergeron with Agence QMI. Please go ahead. À vous la parole.
Oui, bonjour. Ma question est pour Madame Freeland également dans la même veine. Monsieur Trudeau ce matin a dit qu'il n'était pas question de mesures de représailles pour l'instant. Qu'est-ce que ça prendrait au fil des discussions pour que le Canada impose des mesures de représailles aux États-Unis?
Pendant les négociations autour de ALENA, j'ai eu une pratique et c'était de ne pas faire les prognoses des décisions qu'il sera nécessaire de prendre en avenir. Maintenant, jusqu'à ce moment-là, notre travail, notre devoir est de résoudre cet enjeu en manière positive pour le Canada, pour les États-Unis et pour 3M. C'est ce qu'on essaie de faire. Et je veux aussi souligner qu'on a déjà eu des enjeux difficiles entre le Canada et les États-Unis pendant cette crise. L'idée d'avoir les militaires américains à la frontière, la question des restrictions dans notre frontière. On a réussi à résoudre ces enjeux difficiles et on va travailler pour résoudre cet enjeu aussi.
Merci. Ma deuxième question est pour le ministre Duclos. Il y a beaucoup d'inquiétudes par rapport à la prestation canadienne d'urgence, le fait qu'elle ne serait pas accessible aux pompiers volontaires, aux élus municipaux, parce qu'ils reçoivent quand même un petit revenu et parfois c'est pas pendant 14 jours consécutifs qu'ils ne vont toucher aucun revenu. Qu'est-ce que le gouvernement fait pour aider ces cas particuliers-là?
Merci pour la question. Pour les pompiers volontaires qui nous écoutent, soyons très clairs. Éteignez les feux, sauvez des vies, on va prendre soin durant la mise en place de la prestation canadienne d'urgence. Comme on sait, c'est un programme extraordinaire dans un cadre de mesures extraordinaires. Tous les détails ne sont pas encore disponibles. Les gens ont hâte de tous les connaître. On fait ce qu'on peut, on fait ce qu'on doit pour fournir toutes les informations au moment opportun. Comme vous savez, on procède à une vitesse grand V. Le site pour faire une demande est déjà disponible. Les applications vont être possibles à partir du 6 avril prochain. Donc, on continue de travailler très fort parce qu'on sait à quel point c'est important pour tous les Canadiens et certainement pour tous les Québécois.
Thank you. We'll turn to the room now. Julie Van Dusen, CBC.
Regarding these N95 masks, I mean, they're not just widgets, they're life and death for medical professionals. So, when you have a president telling an organization not to export them, I mean, there can't be any fooling around. So I'm wondering if he doesn't back down, are you not going to move to the next step? I mean, the Prime Minister mentioned the nurses that go back and forth between Windsor and Detroit. I mean, is that not a possibility that, you do this to us, we're going to do something to you?
Julie, I completely agree with the way you started your question. And I think it is so important for us to all be very clear that we understand, particularly for Canada's frontline health workers, that having the necessary personal protective equipment is a matter of life and death. These people are Canada's heroes today. I think I speak for all Canadians in saying we are incredibly grateful to you for your work. And we as a government, and I think this is true of all the governments across the country, understand it is our job to get you the tools you need to do your work safely. So we are totally seized of this issue. When it comes to the question of medical exports from the United States to Canada, thus far, we have managed to keep that pipeline open. And as you point out, Julie, the support flows in both directions. I discussed with Ambassador Lighthizer last night the very real and important example of how Canadian doctors and nurses travel from Windsor to Detroit every day and are doing life-saving work for the people of Detroit. And he was actually aware of that because it came up during the NAFTA negotiations. So we are making that point directly with our U.S. counterparts. We are also very clear with our U.S. counterparts that the United States has no closer economic and security partner than Canada. In fact, by U.S. law, Canada is part of the U.S. military-industrial complex. Health is part of security, and we believe that we need to have a partnership when it comes to health on this continent and when it comes to the health of Canadians and Americans. So we are making that point very urgently and forcefully, and we are going to work to get this resolved. As to the hypothetical of what would happen if it doesn't get resolved, the first step is to resolve it. But I do want to assure Canadians that our government, as has been demonstrated by our actions, is prepared to do whatever it takes to defend the national interest. We showed that during the NAFTA negotiations. And of course, that is the approach we are continuing to take in this fight against the coronavirus.
Okay, great, thank you. Dr. Tam, I was wondering if you could just comment on the fact that a lot of the studies are showing, the one in Iceland, for example, that people who don't have symptoms are spreading the virus. And that one, I think it was 50% of those studied. So I'm just wondering, are you going to rethink your the fact that maybe we should have more testing of people who don't have symptoms, essential workers, for example, who are out and about, who could be spreading it, and also the question of masks. New Yorkers are now being told to wear something over their faces.
Absolutely. We're learning about the virus and the way that it transmits as we're going along right now. So the kind of studies that you've been mentioning are precisely the ones that we're trying to gather and analyze. It wasn't really until the last few days, almost in weeks, that a number of studies have come out, so we're actively reviewing those. And we do understand that they could essentially result in a number of changes, perhaps in how public health manages the current outbreak. And including, I would say, the most important aspect is not whether you have pre-symptomatic cases or asymptomatic cases, is how much do they transmit at what point in time and under what conditions. So we are paying particular attention, if you can imagine, in long-term care facilities. How does that change our policies? We did talk a bit about the wearing of masks in the sort of general community setting. And as I've sort of said, we do have to keep learning and incorporating the knowledge. Right now, in that setting, the most important messages are several. One is that we must keep medical masks for those who are managing patients, our healthcare workers. But if you were to wear a non-medical mask, for example, if you were making some homemade mask and others, while it hasn't been proven really to protect you from getting the virus, wearing a non-medical mask is an additional measure you can take to protect others. So as I said, it's a bit like covering your cough. If some people are infected, but they don't know that they're infected or they are pre-symptomatic, that layer of protection is a way that you can protect others. So that's the area that we're examining right now. So really, the key message, though, is that whether you wear the mask or not, you should maintain all of those strict hygienic and physical distancing measures that have been proven to be very important in reducing transmission of this outbreak. So really, I think if wearing a mask makes you feel safer, stops you from touching your nose and your mouth, it's important then to learn how to use a mask. So including hand hygiene, washing your hands before and after, making sure the mask is not gaping, it fits well against your face, never share it with others, etc. So I think we're all learning through, I think particularly Western societies that are not used to wearing masks in public, are sort of learning this as we are going along. And so some of this information, I think, is in real time undergoing evolution. And so I think with the Chief Medical Officer of Health, we will be looking at those latest published studies and see if that changes practice in our communities and our hospitals. So I think it is most important to test people who have symptoms. In certain circumstances, though, such as in an outbreak or in, as you said, in certain contexts where someone is a close contact, that type of thing, I think the testing regimens have to sort of align with the latest science. What I've always said, though, is that testing should also be adjusted to the epidemiology of the outbreak in the community, whether you have community transmission or not, where you have outbreaks or not, and where they are. So I think all of those science has to be integrated for sure.
Thank you. Friendly reminder, one question, one follow-up.
Hi, ministers and doctors. Thanks for making time for us. Molly Thomas, CTV National News. If a company is charging inflated prices, for protective equipment, thinking about masks and gowns here, what is the federal government prepared to do? Maybe Minister Hajdu, this would be for you.
Well, thank you very much. It's partially for me and perhaps partially for the Deputy Prime Minister, but I will say right now we're focused on getting the equipment that we need. And I will say the prices are inflated all around the world, and it is an extremely competitive process, as you know, with all countries fighting to get personal protective equipment and other medical devices for their populations. And so, as the Deputy Prime Minister has said, we are operating in the current marketplace, which means that we have to pay the current prices. Having said that, obviously we're watching very carefully in terms of the fraud that is also being expressed in that marketplace. And so the wonderful people at the Public Health Agency of Canada, for example, ensure that the product that we are purchasing meets the specifications that are required to actually protect healthcare workers. There's a lot of counterfeit PPE that's now being produced. There are a lot of people that are arbitraging PPE or being the middleman, if you will, and offering for sale a product that doesn't even exist. I think one of my colleagues described it well in saying that this is the Wild West of procurement. And what we're trying to do as a country is obviously keep an eye on the cost, but also knowing that we are going to have to pay inflated prices in a market where there is a high demand for these products, and also at the same time ensuring that the product that we're purchasing actually meets the specifications and meets the requirements that it's intended to provide. For example, there's no point in procuring N95 masks masks that don't provide that level of protection, and then giving them to healthcare workers who may not be aware that they're protected to the full capacity of that particular specification. So all of that work is happening live, and I want to thank again Minister Anand's group and with the Deputy Prime Minister, the work that's happening to make sure that those specifications are met and that we're getting the best possible value in a very, very tight market.
Second question is perhaps for Minister Duclos. I've been talking to university students all week. There's more than 300,000 that are graduating this year. Many had jobs lined up. They are canceled now or postponed. They're riddled in student debt. They obviously don't fall under EI. They don't fall under the emergency benefit because they didn't make enough money. Is your government considering anything for this group? And what is your message to these students that are supposed to be starting their lives?
Yeah, we're very mindful of the very severe circumstances in which many Canadians, including students, find themselves. There's a lot of anxiety, a lot of insecurity around health and the ability to make ends meet. And that's where we have designed and we're putting into place rapid measures to address the most urgent needs. And through the Canada Emergency Response Benefit, that benefit is designed for those that have lost or losing all of their income and therefore have no money whatsoever to pay for food on the table and other expenses. We are also putting into place, as we have announced a moment ago, measures to alleviate the burden that students would be bearing at this point and looking forward. And there will be other things as well. There are, as you know, an important announcement just a few days ago around emergency wage subsidies, which we believe will be of great help to all workers, and in particular students who would perhaps be otherwise facing a market that would be tremendously more difficult for them. So the wage subsidies that are enabling businesses to either hire or rehire people are also going to be supportive to many businesses and students that would like to be working closer together over the next few weeks.
Thank you. One question, one follow-up. Next question, Stephen Chase, Globe and Mail.
Excuse me, Stephen Chase, Globe and Mail. My question's for the Health Minister. I want to follow up on your comments yesterday to journalists regarding China's infection rates. You were asked several times about whether there are concerns about the rates that China is reporting. And you told the journalists that they were feeding conspiracy theories by asking these questions. There are stories in the New York Times, in Bloomberg, in BBC about the U.S., the CIA, telling the American administration that China is vastly underreporting its infection rates. As we try to build predictive models on how the virus is going to hit here, what evidence do you have or to sort of suggest that someone who mentions that is feeding a conspiracy theory?
Well, thank you very much for the question. And first of all, I'll say that our focus is firmly on making sure that Canada has the best response possible to a global pandemic where obviously it may feel like we've been in this for years, but we've been in this for 3.5 months. We work extremely closely with the World Health Organization, as you know, and Dr. Tam is actually an expert advisor on the committee that has been struck since the beginning of the emergence of the coronavirus. And the evidence that has come out of the World Health Organization is credible evidence. It's actually very closely modeling what we're experiencing in Canada. Of course, as Dr. Tam has said today, science evolves. And the way that the disease expresses in different countries based on different patterns of epidemiology, I think is extremely important for us to learn. And obviously, we're watching closely in Canada as we see our own surge. But how it compares to other countries is the work of the World Health Organization. And we have every confidence in the work that the organization is conducting to provide the best evidence possible to countries like ours who are further along in the first wave of the illness.
And just a follow-up question. I was reading the New York Times today. China has reported about 6 coronavirus cases per 100,000. I want to ask about the intelligence information reporting that's coming to your office.
Testing and learning around serology that will perhaps provide us a better understanding of exposure in our population. You've heard Dr. Tam speak extensively about our testing strategy. I am certain other countries have equally complex testing strategies based on the availability of the equipment and material that go into those tests. And so I am grateful for the work of the World Health Organization. I think these kinds of global institutions are extremely valuable in the face of a global pandemic because, of course, we know that if the coronavirus is in one country, it means the rest of the world is not safe, and that we need to work together to defeat this virus. Thank you.
Thank you, Minister. We're running short on time. We'll get 3 more questions on the phone and call it a day. Operator?
Thank you. Merci. Our next question, notre prochaine question, is from Ryan Tumulty with the National Post. Please go ahead. À vous la parole.
Yeah, hi there. I wanted to ask about modeling. You said in the past couple of days that you're trying to get better data from provincial governments. I'm wondering if the data you're getting, given that you need the better data, are you concerned about that you don't have enough good data to make good decisions today, even with the models that you're generating internally?
Well, I'll start and then I'll turn it to Dr. Tam to talk about the work she does with a special committee. But first of all, the modeling, the data is coming along. Obviously, provinces and territories are at various stages of the outbreak in their own particular jurisdictions and have different capacities. And we've been working with provinces and territories to make sure they have the resources they need to provide the most granular data possible. It is more than just the number of cases and the number of deaths. Obviously, the more that we can learn about each particular situation, the more granular, in other words, the data is, the better we can predict what it will behave like in other populations, other parts of the province, and other parts of the country. And all of that information helps with the modeling that can then help governments of all sizes, of all levels, understand whether the measures they're taking are actually in any way reducing the curve, what kinds of other expressions of disease we might be seeing across the country. And so I'll just say this to answer quickly. We will be providing national modeling in the days to come. We're very grateful that Ontario and BC and, in fact, Alberta are very close to providing their own models. I understand Ontario is today. And I will tell you that the models are our best estimate of what might happen in certain circumstances, and that those will fluctuate as time goes on. But I'll turn to Dr. Tam if you have any further words about the modeling at a national level.
Yes, so throughout the actual pandemic, we have been working with epidemiologists and modelers from across the country. So I think people are making the effort to gather the actual real-time information, particularly the epidemiology, the lab data, and some of the clinical data. What you will see from provinces and territories and from ourselves, I think, are 2 fundamental types of modeling or actual projections. So both are attempting to help us plan and look forwards to what might happen next. One type of model, I think we're getting the information for, the one that the curves that you see where you just look at the cumulative number of cases gives you a curve that you can use. And we've been using those, but to look at how might that trajectory go, but in the short term. So we accumulate the information and look at, well, in the next 5 days, what might happen, benchmarking ourselves against countries that have gone before us. So, but of course, different countries are not necessarily comparable in their epidemiology or the way that they do their testing, but is one way of looking at shorter term projections and where we might be in the next week or so. There are other types of models, and they are more mathematical in nature and more theoretical, and they use different mathematical functions to help us produce different types of curves, different attack rates, etc., to see where things are at. They can be adjusted using real-time information to see if they fit certain scenarios. Those are used for planning purposes, and you will see from British Columbia and probably from Ontario today what kind of numbers they're sort of looking at in different scenarios in their planning purposes. Those kind of models help us look at, well, what is the approach in terms of social distancing or the quarantining of people who may be exposed and how they play a role in helping us control the outbreak itself. These types of models can help particularly provinces or local areas plan for their healthcare resources, for example. What's the peak number of people who might need an ICU bed under different circumstances? So you will see some of those. What I would say is, when people see these models, remember that they're not real data. They are projections for planning purposes. And they, so I think one of the lessons, I think, coming out of some of those models, for example, they can't necessarily tell us exactly how long we're going to maintain social distancing, but they're going to tell us that we have to maintain it for a considerable amount of time. However, everything that we do now and do fast will reduce the impact, and that we hope that, it'll be a shorter time that we may be able to maintain some of those measures and calibrate against those. So it's really two different types of models and projections, and they are for different purposes. And we're very happy to have worked with a number of the academic experts and the provinces to do some of that.
Just a follow-up. Mr. Freeland, I'm hearing from a lot of municipalities. They've started doing layoffs, and they're concerned about their own financial picture because they, as a general rule, can't borrow for their operating costs. Is this something, the federal government is looking at? I know it's not really your jurisdiction, but is it something you're looking at in terms of backing some of these large cities that might start to run out of money?
Yeah, thank you for the question. I'm hearing from the municipalities too, and we work closely with Canada's municipalities. It's something that, and we know that the municipalities are really on the front lines of this fight, and they are working so hard and doing a great job. We are also talking with the provinces about this issue, as well as talking with the municipalities about it.
Thank you. Merci. Our next question, notre prochaine question is from Catherine Lévesque avec la presse canadienne. Please go ahead. À vous la parole.
Oui, bonjour. In fact, my first question is to Dr. Tam or maybe Minister Hajdu, because we've actually are getting the numbers from Ontario right now. They're saying that between 3,000 and 15,000 could die in the province, even with the public health measures in place. So, Dr. Tam, you said this is not real data. These are just projections. But can you tell us if these numbers are realistic? Thank you.
So I would say that those are still the numbers for planning purposes, and you have to adjust it based on real-time information. So you will see the numbers of hospitalizations, ICU utilization being reported in Ontario right now. So you have to actually look at both. You have to look at the evolution and the growth rate of the epidemic as it is actually happening in Ontario, and then those projections. What I can say, though, is right now, as I said, the health system is coping. So if you looked at the numbers of people now currently in ICUs and hospitals in Ontario, that is, of course, sort of underneath that line that I keep talking about, where you have to flatten the curve so that it gets underneath the healthcare capacity. Well, it is below that. That is the key piece to focus on. But, you got to plan for something worse than this. So these kind of numbers, they look very, very high. But if you looked at other countries around the world, which is what I was saying, is that many countries in the world have gone before us, have experienced even greater impacts to date, and have managed to get the epidemic under that first wave under control. So this is what we all need to do, and focus on the here and now to actually do everything that we can to reduce that curve, to flatten it. And if you looked at that cumulative case curve that goes like this, where you want to be like South Korea and plank the thing, that line has to go horizontal, and that's what we're all aiming for.
Okay. Merci. Et ma deuxième question, c'est pour M. Duclos. Donc, vous avez dit tout à l'heure que les aides viendront sous peu pour ceux qui sont éligibles pour la PCU, mais comme vous savez, il y a tellement de zones. Il y a des gens qui ne savent pas s'ils sont éligibles ou pas. Si aujourd'hui, aujourd'hui, à 3 jours du lancement du programme, ce n'est pas le temps opportun. C'est quand le temps opportun pour dévoiler les détails?
Bien, il y a des cas très spécifiques, merci de la question, des cas très spécifiques dont je parlais des pompiers volontaires. Et j'ai dit très clairement, et on dit très clairement à ces pompiers volontaires de faire leur devoir, de sauver des vies, et on va s'occuper d'eux par la suite. Ceci étant dit, la plupart des Canadiens et des Québécois comprennent les paramètres de la prestation canadienne d'urgence et ont déjà commencé à aller voir sur le site et à prévoir leur demande d'application qui pourront commencer lundi prochain. Donc, pour la grande majorité des cas, tout est en place, les gens sont rassurés. Moi, j'ai parlé à des maires de la région de Québec ce matin, les gens sont contents de pouvoir, comme je disais, être rassurés qu'ils vont pouvoir, au cours des prochaines semaines, joindre les deux bouts. Il y a des cas plutôt spécifiques comme celui des pompiers volontaires pour lesquels les informations ne sont pas encore parfaites, mais on y travaille très fort et ça va venir rapidement.
Merci.
Thank you.
Dernière question.
Merci. La prochaine question, our next question is from Micheline Laflamme avec Radio-Canada. Please go ahead. À vous la parole.
Oui, bonjour. J'aimerais peut-être revenir sur les masques. Et, bon, Madame Freeland, vous avez donné une bonne indication des démarches que vous êtes en train d'entreprendre, mais de façon plus générale, est-ce que quel en est l'approvisionnement en ce moment au Canada? Il n'y a pas si longtemps, je crois que Dr. Tam et Mme Hajdu parlaient qu'on était autosuffisant pour environ 75 de masques. Est-ce qu'on peut nous donner plus d'informations sur justement l'approvisionnement, où est-ce qu'on en est?
On a assez pour maintenant, mais on a besoin de plus pour les jours, les semaines en avance. Et c'est pour cette raison que notre effort en acheter d'un côté les approvisionnements et d'autre côté les manufacturiers au Canada est si importante et si urgente. Et c'est aussi une des raisons, Madame Hajdu, Patty a déjà parlé de l'importance de la diversification de nos efforts. Et c'est aussi une chose très importante parce que, comme Patty a dit, maintenant, nous devons comprendre que tous les pays dans le monde sont dans la même situation que nous. Le résultat est qu'il y a vraiment une concurrence très, très grande dans le marché international. Le Canada est une joueur forte dans cette concurrence et en même temps, c'est très important pour nous de fabriquer ce qu'on peut fabriquer ici chez nous et on est en train de faire ça aussi. Peut-être Dr. Tam veut ajouter quelque chose. Do you want to add anything on that? Dr. Njoo? No? Okay.
One follow-up?
Oui, j'aimerais revenir, Dr. Njoo, peut-être s'il pouvait commenter les données révélées ce matin par le gouvernement de l'Ontario sur de 12 500 de morts avec les projections qu'ils ont, là, que ça pourrait aller jusque-là. Comment évaluez-vous? Enfin, quelle est votre évaluation de ça? Et puis aussi, est-ce qu'on doit augmenter les tests au sein de la population ontarienne pour avoir aussi un meilleur portrait de la situation? Merci.
Oui, bonjour, merci pour la question. Oui, c'est sûr, c'est important pour l'Ontario et les autorités sanitaires de l'Ontario de faire leur propre modélisation parce que c'est vraiment les autorités en Ontario qui ont les données, qui savent exactement qu'est-ce qui se passe sur le terrain. Et c'est très important pour la planification, peut-être pour qu'est-ce qu'on peut avoir comme les besoins pour les soins de santé. Pour nous autres, on respecte, on sait, il y a beaucoup des experts qui travaillent en Ontario. Et nous autres, ici, à l'échelle fédérale, Dr. Tam, moi, on travaille étroitement avec nos homologues en Ontario. Et on pense que ils ont fait un bon travail. Mais comme Dr. Tam aussi constaté, moi aussi, que c'est toujours les données on utilise actuellement, c'est les cas qui ce sont les résultats de l'exposition il y a 2-3 semaines. Alors, il y a beaucoup d'incertitudes dans les données et c'est très important de continuer avec nos efforts collectifs, les mesures comme l'éloignement physique, parce qu'on peut toujours changer qu'est-ce qui se passe avec peut-être les projections. Les projections maintenant, c'est basé sur les données il y a déjà 2, 3, 4 semaines. Et à l'avenir, et c'est quelque chose à voir, qu'est-ce qui va se passer dans les semaines prochaines. Donc, je pense que pour l'objectif de planification, c'est un début, mais il faut toujours voir qu'est-ce qui va se passer dans les semaines prochaines. Et comme on a dit toujours, souligner l'importance pour tous les Canadiens, aussi les Ontariens, de continuer avec leurs efforts de l'éloignement physique. Et c'est sûr aussi, si on parle de la capacité pour tester en Ontario, on sait que nos homologues en Ontario continuent avec leurs efforts d'augmenter la capacité de tester tous les citoyens de l'Ontario, comme c'est nécessaire parce que c'est sûr qu'il y a une priorité pour les populations, comme Dr. Tam et moi a dit plusieurs fois. Si on est un travailleur symptomatique dans un établissement de soins à longue durée ou un hôpital, c'est très important d'avoir un diagnostic le plus tôt possible. Merci.
Merci, docteur. Ceci met fin à la conférence de presse d'aujourd'hui. Merci.